I'm going to be presenting to you the Phymedica electronic medical record. And as we go through this, I want you to see how easy our system is to use for physicians. Our system was built by physicians for physicians, and the number one complaint with doctors is the ease of use. And the way we've done our system is we've made it very easy for them to use and made it used to what they're doing now. We also have different patents within our program to make it very easy to use. We have the graphics, which is a nice educational piece for not only the physician but for the patient. We also have a natural language generator, which provides an elegant note at the end of the visit for the physician. And we also have a coding engine. Physicians lose about $40,000 per year for undercoding. And what we've done is that we've given them the tools to be able to make sure they use the correct codes and bill them correctly. What you are seeing now is the DocPad home screen. We put the most important information on the DocPad home screen so they can easily get to what they need to see very quickly and easily. What I'm going to do is I'm going to go into a patient chart now. I'm going to choose Incomplete Notes. I'm going to choose Noah Hernandez. And as you can see, I'm in tablet mode, so I'm on a tablet just simply touching my screen, which makes it very easy and fast for the physician. Once we pull up the face sheet for a patient, you're going to see it looks just like a paper chart over here on the right-hand side. And we also follow the SOAP format, which is subjective, objective, assessment, order, and plan that physicians do now. And that's very important to physicians because it provides them what they need to the insurance company so they can get paid. Up at the top, we have our history. We have any previous medications they may have been on. We also have family and social history. And the most important things on this screen are allergies, vitals. You can simply put in vitals. You can review any past notes of why they came in before. You can look at any past lab results. And you can also look at any lab results they may have now. And then you can also review the medical history. I'm going to come down here to the bottom, and I'm going to choose Chief Complaint. Now, once you get to the Chief Complaint, you're going to see that our system starts to get pretty graphical. And there's different ways that you can search within our program. And we make it very easy for the end user. They can either write information in. So for example, if that patient has a sore throat, they can put in sore here. It's going to pull up sore throat. I can simply choose sore throat and make that green, and now that's one of our chief complaints. Or if, for example, they came in for shoulder pain, I can simply click on the graphic here with the arrow. I'm going to say that their right shoulder was affected. I can say it's shoulder pain, and now you're going to see that there's multiple chief complaints. What's also nice within our program, we've given the end user the option to be able to document any information that they want to. We know that each patient is unique, so we want to be able to give the ability to be able to document any information that that end user would like to put into the system. So for example, I can annotate any information here by simply writing it, typing it, or speaking it. We have an interface with Dragon Medical 11. Now, I'm going to come to my history and present illness screen. And as you can see, it quickly pulls up. I can easily change my complaint to sore throat or shoulder pain. But what I'm going to do is focus on a sore throat here. I'm going to say it's a new symptom. It was recently in history. It's pretty worse. The onset was 4 days ago. Simply just write that information in. It's going to put it in the text. I can easily click on the calendar. Say it was on the 24th. Timing of the sore throat is constant. Severity is pretty severe. Any other symptoms, maybe difficulty swallowing, there's red throat. I can say it's improved by ibuprofen. Right now there's a fever with it. They have exposure to strep. We'll say that the clinical status is stable. Now I'm going to come into my review of systems. Review of systems is very important. When I talked about the coding earlier, it helps with that code, but it's also information that the insurance companies need from the physicians. Now instead of me having to choose each one of these, I can simply swipe down with my pen to make them all positive. Or I can simply swipe up to make them all negative, simply swipe up to make them all positive. So what I want to do is I want to make them all negative, so I'm going to swipe down with my pen, hit page down, and I'm going to finish swiping here with my pen. So as you can see, it makes it very, very simple for the physician to do that. Now I'm going to move to my other complaint, which was my shoulder. I'm going to click into shoulder pain. Onset, we'll say, was the 24th. It developed suddenly. It affected the right shoulder. And all I'm doing right here is just showing exactly where it is in the shoulder, on the outside region of the shoulder. So I'm going to say it's upper and lower, pain with movement, there's swelling, and limited range of motion and a lot of weakness. Now I can say this is an acute injury, the timing is constant, and I can say it's worsening. Once again, my review of systems is going to save here, so it's going to be green. And I can also come in and say, is it worsened by activity? Yes. When I move to my physical exam, this is where the doctor spends most of their time. And what's nice about our program is what we've done is we've given the capability to be able to personalize their normals. Why that's important is because they want to be able to quickly move through the physical exam so they can easily get to other screens and then go on to their next patient. So we're going to click general here. Eyes are normal, lungs are normal, cardio is normal, lymph, skin, neuro is all normal. What that is doing is making everything over here now check marked in green. What we want to focus on is what is not normal, and that's going to be the sore throat. So what I do is I touch the arrow, and that's going to pull up our graphics. And this is where our system gets very unique, is because we actually have working graphics. I can turn this patient's head around. I can easily go into the mouth. I want to go into the pharynx. And I want to say there's swelling and white patches. And what you'll see is the graphic here. Now say, for example, if the patient had ear pain, I can simply click on the ear, hit tympanic membrane, and what it's doing is it's highlighting that area. So it's a nice educational tool for the patient. Now, what I want to do is I want to go to the shoulder because I want to focus on the shoulder pain. And it affected the right shoulder, so I'm going to choose the arrow. Now I can drill into muscles and tendons, and you'll see how very graphical this is. And doctors are used to graphics. They really love to be able to navigate through the system using these graphical images. I can go to bones and joints. I can go to ligaments. I can go to nerves and also sensations. But let's focus on ligaments and say that I want to go into my labrum. And as you can see, it highlights the labrum, so it shows the end user exactly where that's at, and you can also tell the patient where your labrum is. I'm going to say painful motion and instability. Hit close there. I can simply also go into the knee. Once again, you can look muscles and tendons, the front and back of the knee, ligaments and bursas. A lot of people tear their ACLs, so you can show them exactly where their ACL is. Bones and joints, nerves and vessels, and sensations. So you can see how our graphics can grab the attention of the physicians and also the patients for that educational tool. I'm going to come into my diagnosis codes. And what it's doing is it's following exactly what I did in my chief complaint. So we have shoulder pain here, so I don't have to navigate too far from my shoulder pain, but I also had sore throat. So if I'd like to, I can easily write in maybe strep throat up here at the top, easily putting in 3 letters. We're going to come in, hit strep. We'll say strep throat 034.0, but I can also easily search by using the code also. Then I come into my orders, and what's important about your orders is we've given the physician the customization of being able to personalize their orders. So for example, if I come into my common orders, and they give a lot of the x-rays of the right arm right here, the shoulder view, and also throat cultures. So I can simply, easily, and quickly move to that and go to that screen. Now when I come into my prescriptions, it's following the diagnoses that we gave to the patient on the prescriptions. I can go to search here and say that I want to give them Augmentin for their sore throat. And then we'll give them something else for their shoulder. I can simply choose Augmentin. We're going to say oral, 500 milligrams. We're going to say 1 tab, twice a day here. We're going to say dispense 2 tablets. Click the number of units here. Scroll down and use tab. For the tablets, we're going to say we'll put them on it for 14 days. Hit sign. And we do have the electronic e-prescribe, which will send this to the pharmacy of their choice electronically. Now what this is doing is making sure that everything is correct. Any annotations that the doctor wants to put, they can put here. Simply choose sign, and now that's at the pharmacy. So if I wanted to give them Celebrex for the shoulder, simply go in and write Cell, C-E-L. Once again, same kind of thing, give them Celebrex, oral. We would do the same thing for the e-prescribe and send that to the pharmacy. Now we're going to come to the very end to our note. And as you can see, the documentation and everything that we chose, everything that we wrote in is all being put into an elegant note. Put into prose, and this is exactly what the physician can send to the insurance company. Notice how much time this is saving the doctor by simply choosing the information that we did earlier throughout our program here. It all puts it into a note. So you can simply see the note here, and I'll let you read it here for a minute. Then what I can do is I can hit page down. It's going to give me my review of systems. Hit page down again. It's going to give me any allergies. It's also going to give me my physical exam. So you notice that we had swelling and white patches, and then also painful motion in our right labrum. It's going to give us our test results, any assessments, which is our diagnosis codes, any plans that we had here, and then it's going to come down to our final E&M code, which is 99214. And what's nice about our E&M codes is that it's following exactly how much information that we did in the system in our history and present illness and in our physical exam. What it's doing, it's protecting physicians from RAC audits. So for example, if I want to make my medical decision making moderate, I can. And if I wanted to, I could easily override this code, but I'm not going to because it's giving me a 99214. I'm simply going to touch done. Now my CPT code is 99214. I want to come down here and sign off on my note, and that's going to bring me back to my home screen. Now I can easily move on to my next patient. So now you can see how important it is, not only for the documentation within our program, but how easy a physician can walk through our electronic medical record, document the information needed, and simply move on to the next patient. Thank you.